us to observe this year's World TB Day. Dr. Rudy Naku, for warmly media friends, for program officer. This college has been very privileged to have different programs conducted here, and our students have also been enlightened, and they have been also enriched in several other programs, which it is which is meeting to the community. These different programs have been enriching our students, and this is one program again that has come, and we are very happy that it is going to be observed here together with our students. So we are very happy, and I'm sure will be a worth a worthy program that will be observed, and I'm sure there will be a lot of takeaways from the observation of the program. So I wish everyone all the best, and once again I would like to welcome each and every one of you into today's program. Thank you.
We also do like today for all of us to understand some three 200 200 and almost 214 villages have been declared TB free in Nagaland, and in all the districts these TB free villages are being uh, awarded and certified through the our district administration, and we encourage them to continue maintaining this TB free status. And also during these days, we, as you must have seen in the program, during these days we take opportunity for uh, coming up with TB survivors who are patients who have completed their treatment and being cured, to share their experiences. So as this is primarily to do with uh, reducing the stigma associated with TB. And for us to understand why stigma is associated with TB, as I mentioned earlier, the sole reason appears to be that since it's a long treatment, prolonged treatment, people don't come up for treatment. That is when the disease again gets transmitted, so and so forth. So this, as if we can reduce the stigma, definitely TB elimination can happen. Our TB program functions like we have in the state. We are under the Department of Health and Family Welfare, and within that, ours is it's called a TB cell, and we provide guidances to the districts and ensure that medicines and whatever benefits GOA provides to us, it reaches to the patients. And likewise, at the district level, there is a district TB center which is headed by the district TB officer and staff. And in almost all, you can just presume that every subdivision would be having a TB TB unit, which we call DM microscopy center also, and then likewise in some districts they have DM designated microscopy centers, and in all urban setups we also have a microscopy center, and right down to the village level we have this dot provider, which are some NGO or maybe some of our sub-center staffs, our ANMs, and then if you are aware, we also have ashas, people called ashas, who are volunteer workers who are coordinating, who are linked with our department, and they help in providing the services even down to the village level. So this is Nagalanga demography, but we will just go through. As I mentioned earlier, we have like at the state level, we have the state TB officer. Then at the district level, there are DTOs, and then below the DMCs and all, we have treatment supervisors and treatment lab tech supervisors and all. So the key initiatives of our program are, as I mentioned earlier, TB-free districts, and then active case finding, coordinate with the private sector, and we also provide community support for TB patients, like I mentioned, the DBD benefits and all, and provide differentiated TB care through a single window patient support system. Multi-sectoral approaches, collaborative efforts, which is what we are doing today here. And so briefly, having said all of that, I feel that we need to know a bit outline of what is TB disease. Of course, it's all there in public domain. Information is there in public domain. If you're interested, you can always Google and get details also. But primarily, TB disease is an infectious disease caused by Mycobacterium tuberculosis. It's spread through droplet, we say air droplet infection, which is just like, for us to understand, just the way COVID transmissions, we were all made to understand COVID times, how it's being transmitted. So that is air droplet infection, airborne infection. And factors contributing is like overcrowding and poor sanitary conditions, poor ventilation, malnourishment is a big factor. So that is why we see TB cases mostly in the malnourished section of our society. So signs and symptoms, generally it's like cough when you have cough more than 2 weeks, you should always suspect for TB after having treated with normal antibiotics. If it's not resolving, then it is always good that, and of course your clinician would always suggest that you also get treated. But for us to understand, this is like fever, cough more than 2 weeks, fever, night sweats. Hemoptysis means it's like when there's blood in the cough. So when you have blood in your along with your cough, that is called hemoptysis. Then chest pain, because it affects primarily the lungs, so you have chest pain, shortness of breath, weight loss, loss of appetite, fatigue. At times, what we call like extrapulmonary TB, you get swelling of your glands in your body, so that might also be reason for TB infection. Treatment. These days, we have a fixed dose combination, which is being provided by our government, GOL, and then it's a very, they've simplified the treatment. Early times, there used to be a lot of pills, but now they've simplified the pills in such a way that it's fixed dose, we call fixed dose combination. Generally, TB drugs comes into four different varieties, but all those have been clubbed together and it's been made to fixed drug combinations, fixed dose combination, which are like, again, weight as per your body weight. So our treatment supervisors and even down to the lay persons, down to the village level, the ashas can easily provide you the treatment. And we also have TB preventive therapy, which is given to all household contacts of TB patient after ruling out case of active TB. We also have this one multi-drug resistant TB, which is very virulent, and then it's very challenging to treat. And this is generally caused by non-completion of treatment. We say adherence of treatment. So as I mentioned earlier, TB treatment involves minimum 6 months of treatment. So what happens is patient can all bal lagi bal paise gule, matlab body all improve hoise gule, pauri jai. Generally, I mean, we all, even 7 days antibiotic we don't complete. So when it involves 6 months of therapy, what happens is when the patient starts feeling better, they forget to take the drugs, and that is where this multi-drug resistant TB comes up. And then when that person transmit, an untreated TB patient can transmit to 15 persons in a year. So when that person transmits that TB, it becomes multi-drug resistant. So that is where we all need to be motivating. If at all we come across any TB patients, we need to be motivating to ensure that they complete the treatment. Another new incentive, as I mentioned, besides that 100 rupees per month, we have called energy dense nutrition supplement, which is given to, these are like, as I mentioned earlier, since TB is associated with malnourishment, so even if the medication is given, if your your nutritional status is still low, then experts have come to realize that your curing of TB slows down. So that is where we encourage that, especially for patients who are very malnourished, which is, these are technical terms, are nurses, doctors, and they know how to calculate. But for a body mass index BMI of less than 18.5, we provide these energy dense nutritions. These energy dense nutritions are, you can just say, like protein powders. So this is being provided. This is being launched from this year only. So we'll be providing this to all our patients who are of BMIs less than 18.5. So TB bacilli can affect all organs of the body except hair, teeth, and nails. So you can presume it goes to the brains also, your intestine, your kidney, your spine. So if it goes to your brain and spine, as I mentioned earlier, the treatment is quite prolonged. It's more than around 18 to 1 year to almost, in some cases, even 2 years. And for us to know generally why stigma is associated, TB do tala khandan do TB ase, TB thagibo. So that is the notion that we have. But it's not so. But here we have to understand the fact that since TB transmits within the household, so it is always possible ami TB thakise gole moila gormono TB lagibole the chance ase. Of course, it's not hereditary. Only transmission ekilo de bui thake. Like here we are in this small room together. If we are here more than 3 hours, it's easily possible that a TB patient can infect you. So we have to understand this thing and then disseminate information. We request you to disseminate information accordingly. And as I mentioned, if treatment of TB is left incomplete, it develops into drug-resistant TB. And diagnosis and TB, everything is available free of cost. And even in private sectors also, we have linkages where once a patient is being diagnosed for TB, the medications are provided to the patient free. Of course, in some setups, you might come across where the private setups might suggest you to take purchase medicine, but it is always good that we take the medicines being provided by the GOI, Government of India, which are like standardized WHO fixed dose combinations. So anyway, thank you, and then we hope that in the days to come, when you teach your children and when you interact with the community at large, the information that we have shared today is being disseminated to all concerns. Thank you so much.
January 7 de mokiduri shet bido. Inane moitu 7 de mokiduri she to moitu 6 month dawai khaise. To moi 6 months to dawai khaise. Aru paisa khan bi thik thak paise. Aru ration khan bi thik thak paise. Aru counseling bi market babra kuri dise. Tukane kwala khan bi thik thak khabi moi nishna thakya khanna. Aru moitu alap no hene kutamon so bishi kaise de. Kutamon so do bishi kaise moi. 1 week de temperature brother kaise to moi 3 months de recovery do haise. Aru inali dawai do khatam kori dise. To moi itia to bal hoise. Te karne moi to aji ahine kolemon thaga do moi nishna thakile khala do tik tak khabi de to balbra recovery kori thake. Bishi thanks de aji time dia karne.
As our program officer already mentioned, the Prime Minister TB Muk Bharat Abhiyan, Nikshay Mitra, that is called Nikshay Mitra. Okay, it's an initiative by the government, and we provide food baskets to all the TB patients. Those who consent, we take their consent initially, and those who are willing to take the basket, we identify donors, and yeah, so. We have short of many donors. Okay, so today I take this opportunity to make a challenge to those who are present here, minus the students, to come forward and be a donor for the TB patients. It's approximately, it comes up to 500 per month. So for a period of 6 months, if you adopt a patient, then it will be very beneficial and very supportive to our TB patients who are malnourished. So today I would like to call upon 10 TB patients who are present here. The sponsors for these patients are our principal director, Dr. Miran Inla Sanlam. She's not here. And Dr. Nyan Tan Kikon, our joint director, and our commissioner and secretary, Shri Anup Kinchi. To hand out the food baskets, I would like to call our sir, our mission director, Dr. KVD. Thank you, sir. Mui ekta matibo itu damde patient kan ahi javide. Mr. Visesotio Penye. Visesotio. Tai na thakile Rukonizo. Next to it, next. Rukonizo la will. Nizotonio, I say Nizotonio. Anjali Kumari. Kojoye. Kojoye na thakile arobiza sebra aina uthai dibi. Thank you. Thank you, sir. I would like to call our ma'am, Dr. Elizabeth, to hand over the remaining baskets for the patients. Viruli, I share. Second is Atungbeni W. Shitiri. Next is Ashibu. Next is Yari Sangtam. And lastly, Venolu Vesuhu. Venolu. Okay. Yeah. Thank you, ma'am. Thank you.
Turning commitment into action, led by countries and powered by collective efforts across government, civil society, people affected by TB, donors, youth, development banks, technical agencies, researchers, private sector, etc. By emphasizing country leadership and shared responsibility, the team reframes the TB response as one that is owned, led, and financed at country level while being powered by people and partners at all levels. Its modular structure allows countries and partners to demonstrate leadership and contribution in ways that reflect their specific roles and contexts. The theme of the World TB Day 2026, Yes, We Can End TB, is a bold call to action and a message of hope, affirming that it is possible to get back on track and turn the tide on the TB epidemic. even in a challenging global environment. With decisive country leadership, increased domestic and international investment, rapid uptake of new WHO recommendation and innovation, accelerated action and strong multi-sectoral collaboration, ending TB is not just aspirational, it is achievable. So the key message, here are some few points. So the first point is make investing in TB a strategic political choice. So here investing in TB is not just a health measure, it is a strategic political and economic decision. The evidence is clear. Every dollar invested in TB generates up to $43 in economic and health returns. With sustained political will and committed financing, countries can strengthen health systems, protect communities, and turn the tide on ending TB. And point two, accelerate innovation to reach people faster. Breakthrough tools save lives only when they reach communities. So rapid rollout, the first ever WHO recommended near point of care TB diagnostic test is essential to close gaps in access to care. Point three, protect hard-won gains. Here, global crisis and fiscal pressures threaten TB progress. Countries must protect essential TB services, prevent disruptions, and preserve achievements. Point four, end TB to strengthen health security. TB remains one of the world's deadliest infectious disease. Ending TB builds stronger, more resilient health systems, a critical investment in national and global health security. 5 point, mobilize whole of government, multi-sectoral action. TB is driven by social, economic, and structural inequities and continues to disproportionately affect the poorest and more vulnerable population. So ending TB requires coordinated multi-sectoral action beyond the health sector, backed by strong accountability mechanisms. Point six, the last point here is deliver people-centered TB care. So integrated primary health center level TB services must be accessible, affordable, stigma-free, and community-driven. Engaging civil society and people affected by TB ensures policies and services truly meet people's needs. So what I want to share is ending TB is a choice. Yes, we can end TB through united action, increased investment, and immediate care. So to conclude, I just want to say, let us turn the tide on the world's deadliest infectious disease and ensure a TB-free future for all. Thank you.
Is guided TB through the four approaches of detect, treat, prevent, and build. Early diagnosis and appropriate quality treatment are important for ending TB. To achieve this, the NTEP has expanded the NTEP facilities with the state-of-art molecular diagnostics to almost every health blocks and with CBNet and TrueNet machines. The state is currently equipped with ultra-portable handheld X-ray machine in every district. Free treatment is available for both drug-sensitive and drug-resistant TB cases. Nutritional assistance to patients through Nikshay Poshan Yojana is also available. The date today, March 24, commemorates Dr. Robert Koch's 1882 announcement of the discovery of the TB bacterium, which revolutionized the diagnosis and treatment of the disease. The official theme of the World TB Day 2026, celebrated on 24th March, is Yes, We Can End TB. India's 2026 campaign strategy. The campaign focuses on the home stretch of India's ambitious goal to eliminate TB by 2025-26, which is 5 years ahead of the global 2030 target. 100-day intensified campaign. A major highlight for 2026 is the 100-day National TB Elimination Programme, a stratified strategy aimed at identifying missing TB cases, reducing mortality, and preventing new infections through accelerated action. Nikshay Mitra community support, embodying the power of the people, powering by the people aspect. The campaign encourages individuals and organizations to provide nutritional and psychological support to TB patients. Felicitation of TB Mukt Panchayat. On March 24, 2026, events across districts are specifically recognizing TB Mukt Panchayat, that is the villages that have eliminated TB, to showcase grassroots leadership. The power of Jan Bhagidari, people's participation, in our team is personified by our Nikshay Mitras who have stepped forward to adopt and support TB patients. The call to action. As we reach the target years for our national mission, our work is not done. We must identify early, screen all vulnerable population and general population with symptoms with latest screening technologies, ultra portable handheld digital x-rays, and get a diagnosis with the advanced molecular technologies like CBNAT, TrueNAT, and line probe assays. Support, don't stigmatize. TB is curable. A patient needs your empathy, not distance. Complete the course. Ensure every patient completes their treatment to prevent drug-resistant TB. So in conclusion, let us renew our pledge today with the leadership of our nation and the power of our communities. We will achieve a TB Mukt Bharat. Yes, we can end TB. Thank you for patient hearing.